Good evening, everybody. You're very welcome to tonight's webinar on updates from the HSE, the Medicines Management Programme, focusing on glucose monitoring initiatives. My name is Fiona Leonard. I'm a peer support pharmacist. So before I introduce tonight's speakers, we're just going to kick off on some domestics. So firstly, I must thank everybody for their attendance. You're very, very dedicated to turn up on such an absolutely glorious evening. So our domestics for this evening, this webinar will be recorded. All microphones have been muted. Videos are on or off as you wish. We do recommend that if you're experiencing any problems with connectivity, please turn off your video. If you're having any difficulty with sound, ensure that the sound or the speaker isn't muted or turned down or off on your computer or phone, and you can always try logging off and then logging back in again. Please use the chat function for questions or comments this evening, and we'll have a question and answer session at the end. We may use some anonymized information from the webinar this evening, and there will also be a post-webinar survey for you to provide your feedback. So that information, the link has gone into the chat now, and we'll post it again towards the end of the webinar. So now I'm going to introduce tonight's presenter. So we're very lucky to have Dr. Claire Gorry, Chief 1 Pharmacist from the Medicines Management Programme in the HSE with us this evening, and also Stephen Doran, Chief 1 Pharmacist, Medicines Management Programme from the HSE. So over to you, Claire.
Thank you very much, Fiona. I'm just sharing our slides now. So can you confirm that you can see our slides?
Yeah.
That's great. Thank you very much. So thank you to everyone for joining us this evening on a glorious sunny evening for updates from the HSE's Medicines Management Programme, or MMP, particularly focusing on initiatives relating to glucose monitoring. And just before we go any further, I would like to express our sincere thanks to the IIOP for facilitating this webinar here this evening. So the whole presentation will take approximately 45 minutes. I'm going to speak for around 15 of those, just to provide an introduction to the HSE's Medicines Management Programme and to provide you with a brief overview of some of the areas that we work in, specifically looking at our preferred drugs initiative, prescribing and cost guidance, best value medicines, and health technology management. And then I will hand over to my colleague Stephen, who will take you through some of the health technology management initiatives that have been implemented in relation to glucose monitoring. So Stephen will specifically look at initiatives that have been undertaken for blood glucose test strips. He will look at the rationale for recent initiatives relating to continuous glucose monitoring, or CGM sensors. He'll go through the process for the identification of preferred CGM sensors and the outcome and recommendations from the preferred CGM sensors initiative. So at the end of the presentation, we will both be happy to answer any questions that you may have on the content of the presentation. So just to provide some background, I've included this slide which shows expenditure on the community drug schemes over the past 30 years or so. So this would include expenditure on medicines and products that are dispensed under schemes such as the General Medical Scheme, Drugs Payment Scheme, Long-Term Illness, and so on. So reading the chart from left to right, it's very clear that there has been continued and ongoing growth in medicines expenditure over the past 30 years. And if we look at the years 2020 to 2023, expenditure has been increasing at the rate of approximately €200 million per annum. So in 2020, our expenditure on medicines and products under the community drug schemes was approximately €2.4 billion. In 2023, that was just over €3 billion. And important to note that the community drug schemes expenditure would account for only approximately 85% of overall HSE expenditure on medicines. So looking a little bit more closely, excuse me, at the expenditure data, we can see that this increase in expenditure is apparent across all of the major schemes that we're all familiar with. And these increases in expenditure are attributable to a number of factors, I suppose some of which would include our changing population demographics. So the population is, of course, increasing in size. We have an aging population demographic, and we have an increasing prevalence of some common chronic conditions such as type 2 diabetes. We can also also see the impact of national policy level changes, such as the change to the drugs payment scheme threshold in 2022. And we can see the impact of the ongoing provision of access to new and high cost innovative medicines under the high-tech arrangement. So all of these factors and more are contributing to the ongoing growth in medicines expenditure. So then, to provide some background on the HSE's Medicines Management Programme, we were established in January 2013, so just over 10 years ago now, with the aim of providing sustained national leadership relating to safe, effective and cost-effective prescribing. So within the organisational structure of the HSE, the Medicines Management Programme would report into the Office of the Chief Clinical Officer. And we also work very closely with the Primary Care Reimbursement Service, where we provide recommendations relating to the reimbursement of various medicines and products. And we would also work very closely with the National Clinical Programme in terms of the implementation of our various initiatives. So the MMP work across 5 main areas. We're involved in the identification of preferred drugs and preferred products, in the development of prescribing and cost guidance, in the identification of best value medicines, and in the area of health technology management. So I'm going to provide an update or an overview on each of these areas in turn, starting with the Preferred Drugs Initiative. So the Preferred Drug Initiative identifies a single preferred drug within a therapeutic drug class, and it offers prescribers guidance on selecting, prescribing and monitoring this drug for a particular condition. So our preferred drug evaluation reports identify a preferred drug within a therapeutic class. So for example, a preferred statin, a preferred PPI, preferred ACE inhibitor and so on. And in identifying these preferred drugs, we produce a preferred drug evaluation report. And in this report, we consider various aspects of the medicines in the therapeutic class in order to inform the recommendation. So we consider the available clinical outcome data, the national and international clinical guidelines. We consider the adverse drug reactions and profile of the medicines. We look at contraindications and cautions in use. We consider drug interactions, patient-specific factors, which include hepatic and renal impairment and so on. We look at the cost of the available products within the therapeutic class, and we would also consider national prescribing trends. So all of these contribute to the development of a recommendation for a preferred drug, and our preferred drug evaluation reports are available to download from our website, which is www.hse.ie/MMP. So to date, the MMP have identified 10 preferred drugs across 9 different therapeutic classes. So for example, the preferred ACE inhibitor is ramipril, preferred beta blocker is bisoprolol, preferred proton pump inhibitor is pantoprazole, and preferred statin is atorvastatin. And the use of the preferred medicine, where appropriate for a patient, can lead to efficiencies for the health service in terms of medicines expenditure. And in addition to our preferred drug reports, we also provide a range of prescribing tips and tools which can be downloaded from our website to support prescribers in the prescribing and utilisation of these particular medicines. So to move now to the area of prescribing and cost guidance, in recent years, the MMP have produced prescribing and cost guidance for a number of therapeutic areas with the aim of promoting cost-effective prescribing. And I suppose the overall aim of producing these types of documents is to promote and increase awareness amongst prescribers and other relevant healthcare personnel around the cost of the medicines and products that they are prescribing, and to support them in choosing the lowest cost but equally effective products for patients where appropriate to do so. So the MMP have produced prescribing and cost guidance for the management of dry eye syndrome, and the full evaluation report again is available to download from our website. But shown on the slide here is the summary of the prescribing tips and tools. So in this document, we would identify first and second line treatment options for dry eye syndrome, alternative first line treatment options, as well as nighttime treatment options. And we also include a number of useful practice points for practitioners when recommending or prescribing these products. As I say, all of this information is available to download from our website. Moving on to the area of best value medicines, this is an area where the Medicines Management Programme have been particularly active in recent years. So in best value medicines, when we're identifying best value medicines, the Medicines Management Programme consider a number of factors. And using these best value biological medicines will offer the opportunity to generate efficiencies for the health service when compared with the use of non-BVB or non-best value medicines. So the MMP have identified best value medicines in the following areas: for adalimumab, for etanercept, for glatiramer, for long-acting GCSFs, and for teriparatide. And most recently, the MMP have identified best value biologic medicines for filgrastim. So again, the evaluation report identifying the best value biologic medicines for filgrastim on the high-tech arrangement is available to download from our website, alongside a suite of supportive measures to support the uptake of these particular medicines. The identified best value medicines for filgrastim include Acofil and Tivogastrim, so 2 products. Excuse me, and with effect from the 1st of April 2025, these products have been identified, and the recommendation is that for any patients who are newly initiated on filgrastim onto the high-tech arrangement, that one of these medicines will be prescribed. And as I mentioned before, using these medicines will be associated with significant efficiencies for the health service compared to the use of the non-preferred or the non-BVB medicines. So the HSE has issued communication to prescribers informing them of the identification of the best value medicines for filgrastim, and there is also a circular issued to community pharmacists, which is available to download from the PCRS website. And this contains a large section of questions and answers for healthcare professionals to support the implementation of this initiative. With effect from the 1st of April 2025, all filgrastim containing medicinal products on the high-tech arrangement have been added to the high-tech hub. And at this point in time, both paper-based and hub prescriptions are valid for reimbursement for filgrastim products under the high-tech arrangement, but prescribing via the high-tech hub is encouraged where possible in order to ensure that the prescriptions include both the INN name and the brand name for the product. Now, and then to move on to the area of health technology management. So health technology management is a broad umbrella term to describe measures that are put in place to enhance the safe, effective and cost-effective use of medicines and devices, thereby controlling their utilization and expenditure. And a number of different types of health technology management initiatives have been developed and implemented by the Medicines Management Programme in conjunction with the PCRS in recent years. So the Best Value Medicines Initiative, or BVB programs, would represent an example of health technology management, managed access protocols, which I'm going to come to in the next few slides, and also the implementation of reimbursement application systems and preferred drugs and devices, which Stephen will go through in more detail in relation to the initiatives introduced for glucose monitoring products. So there is a statutory basis for the health technology management initiatives that are introduced and implemented by the Medicines Management Programme, and that is Section 20 of the Health Act from 2013. So under Section 20 of that Act, that allows the executive to attach conditions to the supply of listed items in the interests of one or more of the following: patient safety, cost effectiveness, maximising the appropriate use of the listed items, and appropriately applying the resources available to the executive. So the Act further goes on to specify the types of conditions that can be applied to the supply of listed items, which includes protocols for the supply of those items. And this has allowed for the development implementation of managed access protocols, or MAPs, which outline the reimbursement criteria which can be applied to specific medicines. At the present time, the Medicines Management Programme are operating 27 different MAPs for 35 medicines which are reimbursed for specific indications. So I'm going to provide an update on 2 recently introduced managed access protocols this evening. The first is the managed access protocol for bempedoic acid, which is a first-in-class adenosine triphosphate citrate lyase inhibitor. So it offers a novel mechanism of action for lowering low-density lipoprotein cholesterol, or LDL-C, levels. So there are 2 presentations of bempedoic acid reimbursed by the HSE subject to the managed access protocol. One is Nilemdo, which is bempedoic acid on its own, and the second is Nustendi, which is a combination product containing both bempedoic acid and ezetimibe. And HSE reimbursement is supported for a subpopulation of the licensed indication for these two medicines, subject to a managed access protocol, which outlines the eligibility criteria which must be met in order for reimbursement to be supported. So this slide just shows a summary of the reimbursement criteria for bempedoic acid. It is reimbursed for adults with primary hypercholesterolemia or mixed dyslipidemia who do not reach the LDL-C target levels for their total cardiovascular risk category and have confirmed adherence to the maximum tolerated dosages of statins and ezetimibe. Excuse me, community pharmacists may receive requests for printouts of medicines to establish eligibility for patients under the terms of the managed access protocol for reimbursement to be supported. And an individual reimbursement application must be submitted by prescribers via the online reimbursement application system, demonstrating that the patient meets the reimbursement criteria as outlined in the managed access protocol in order for reimbursement to be supported. The second managed access protocol I'd like to bring to your attention this evening is the managed access protocol for romosozumab. So romosozumab is a monoclonal antibody that binds and inhibits sclerostin, and it is indicated for the treatment of severe osteoporosis in postmenopausal women with high risk of fracture. So it is reimbursed under the high-tech arrangement since the 1st of November 2024. And similar to bempedoic acid, reimbursement is supported for a subpopulation of the licensed indication subject to a managed access protocol. And both managed access protocols are available to download from our website, and they clearly outline all the reimbursement criteria that are applied to these products. So again, similar to bempedoic acid, approved consultants are required to submit an individual patient application for reimbursement support for romosozumab through the online special drug request system, which must demonstrate that the patient meets the reimbursement criteria in order for reimbursement to be supported. And for both romosozumab and bempedoic acid, the patient's approval status is visible under the Secure Scheme Checker available through the PCRS website. So at this point, I'd like to hand over to my colleague, Stephen, who will take you through the preferred products initiatives that have been introduced by the Medicines Management Programme, in particularly relation to the area of glucose monitoring.
Many thanks, Claire, and thank you to everybody for attending this evening, and also thank you to the IIOP for hosting us this evening. So as Claire has just mentioned, another area of interest to the MMP are preferred products. And in particular, it's preferred products for the area of glucose monitoring. So glucose monitoring has long been an accepted part of diabetes management, and recent years have seen rapid developments in the available technologies for glucose monitoring with associated increases in costs. And as Claire has mentioned earlier, health technology management, or HTM, refers to measures being put in place to enhance the safe, effective and cost-effective use of medicines as well as medical devices, such as those for glucose monitoring, thereby controlling utilization and expenditure. And if we take a look back at total annual expenditure associated with glucose monitoring over the years 2013 to 2023. So this chart here shows you the total annual expenditure under the community drug schemes. You'll see the blue segments of the bars represent expenditure on blood glucose test strips, while the orange segments of the bars represent expenditure on continuous glucose monitoring, or CGM sensors. Overall, in 2013, total annual expenditure associated with glucose monitoring was about 46 million. And you'll see that expenditure on blood glucose test strips did start to decrease from the year 2016 onwards. However, at the same time, there has been a rapid and sustained increase in utilization and expenditure under continuous glucose monitoring, or CGM sensors, as represented by the orange segments on the bar. And the MMP have been involved in 4 health technology management initiatives for glucose monitoring devices. In 2016, we had the introduction of automated maximum reimbursement quantities of blood glucose test strips. In 2021, the MMP published a preferred blood glucose test strips initiative. In 2023, we had the introduction of an online reimbursement application system for all CGM sensors. And in 2024, we had the MMP publishing the Preferred CGM Sensors with Associated Systems initiative. So we'll take a look at each of these 4 health technology management initiatives in further detail now, beginning with the automated maximum reimbursement quantities of blood glucose test strips. So in April 2016, based on MMP recommendations in collaboration with the National Clinical Programme for Diabetes, the HSE Primary Care Reimbursement Service introduced an automated validation on pharmacy claims that limited the number of blood glucose test strips that are reimbursed for individuals with type 2 diabetes mellitus. And the maximum quantities reimbursed were based on the recommended testing frequency for different hypoglycemic therapies. Overall, this initiative allowed for a sufficient level of testing for patients while also reducing waste and inappropriate testing. And the blood glucose testing recommendations for people with type 2 diabetes are based on the agents which are prescribed. So if, for example, you have a patient who's receiving insulin alone or in combination with other hypoglycemic drugs, the testing recommendation is that it should be individualized and maybe up to 4 times daily and more frequently if required. Therefore, there is no limit on the yearly reimbursement quantity for these patients. If, for example, you have a patient who's in receipt of metformin, the testing recommendation is 3 times per week if needed, and this translates into a monthly 1 box of 50 test strips per month, which will be reimbursed, or 600 test strips over the course of 1 year. And if we take a look at the change in the reimbursed quantities for blood glucose test strips following the introduction of this initiative. In 2015, the quantity of blood glucose test strips reimbursed was 86.8 million. And in 2016, where we had 9 months of this initiative, the quantity of blood glucose test strips reimbursed was 77.2 million. So that's a reduction of 9.6 million blood glucose test strips. On the right-hand side of the slide, you'll see a snapshot from an online registration system. This system allows for prescribers to apply for an additional allowance of blood glucose test strips if required on behalf of an individual patient. So the second initiative we'll have a look at from the area of glucose monitoring devices is from 2021, and it's the Preferred Blood Glucose Test Strip Initiative. So if we take a look back at the year 2019, there was 35 blood glucose test strips on the reimbursement list. These ranged in reimbursement price from $6.17 to $26.50 for a quantity of 50. And total expenditure in 2019 was 40.5 million. And this expenditure reflected utilisation by about 150,000 people. And when the MMP analysed the market share, 98% of expenditure was on blood glucose test strips costing at least €19 for a quantity of 50. So the MMP undertook this initiative, and the aim was to identify preferred blood glucose test strips with associated meters for adult patients with type 1 and type 2 diabetes mellitus who undertake self-monitoring of blood glucose. And this slide here shows you a snapshot of the blood glucose test strips on the reimbursement list from July 2020. So that was the month prior to the opening of the consultation period in relation to this initiative. At that time, you'll see there was 36 blood glucose test strips on the reimbursement list. You'll see these ranged in cost from $6.17 to $26.50 for a quantity of 50. And also at that time, the HSE was unaware of which test strips were still being supplied and also which versions of the meters were still being supplied for individual test strips. So as part of the evaluation, the MMP looked at 9 different criteria. We considered the acquisition cost of the test strips, in other words, their reimbursed price. We reviewed the shelf life of the test strips, both prior to and post opening the container. We reviewed the availability of patient support services by the supplier and also the availability of education resources to healthcare professionals by the supplier. We considered the robustness of supply of test strips to the Irish market. We also reviewed associated meters and patient factors. as well as the acquisition cost of associated lancets and any other relevant factors, such as the availability of blood ketone test strips. And this is the output of this particular initiative. On our website, hse.ie/MMP, you'll find a 2-page poster in relation to the preferred blood glucose test strips for adults with type 1 and type 2 diabetes. So on the front page of this poster, you'll find the preferred blood glucose test strip list. Here you'll see 12 blood glucose test strips listed, as well as their 18 associated preferred meters. There's also some other information outlined on this poster, for example, a practice point, which includes meters should be registered with the company at the time of initiation of use. And on the second page of this poster, you'll find much more detailed information in relation to the preferred blood glucose test strips and their associated meters. So if we take a look at the top left-hand corner, for example, you'll find the name of the blood glucose test strip, its reimbursement code in brackets, and then its reimbursement price. You'll then find the blood volume or sample size required, the hematocrit range for the product, the open pack expiry of the test strips, and also their test range. You'll then find the name of the supplier and also the contact details for ordering free meters, so the phone number and the email, and also the website which provides patient supports. You'll then find the name of the meter's memory, and also whether an app is available or not for a particular meter. There's also some color coding on this poster. So for example, meters with a blue banner are compatible with blood ketone testing. Meters with a pink banner are compatible, they have talking capability, while meters with an orange banner are compatible with certain insulin pumps. So overall, the MMP recommends the use of a preferred blood glucose test strip when commencing self-monitoring of blood glucose, and when changing blood glucose test strips in people who are not currently using a preferred product. We also recommend to choose a meter that best suits the individual's needs. So for example, to consider visual impairment, dexterity, and technology needs of the individual. And this graph here shows you patient numbers on the preferred and non-preferred products. So the initiative was initially published in February of 2021. So if we take a look back at January 2021, the month prior to the publication, you'll see there was just under 50,000 people in receipt of one of the preferred products, while by December 2023, that number had increased to just under 60,000 people. So it's really positive to see an increase of over 10,000 people in receipt of the preferred products. At the same time, in January 2021, there was just under 20,000 people in receipt of one of the non-preferred products, while by December 2023, that number had decreased to about 8,000 people in receipt of one of the non-preferred products. So to summarise the preferred blood glucose test strips initiative, we've seen a reduction in expenditure on blood glucose test strips, which has been achieved by price reductions attained for some of the preferred products, and also increased utilisation of the preferred blood glucose test strip list. There is further potential for a reduction in expenditure on blood glucose test strips by a continued increase in the use of the preferred blood glucose test strip list. And this initiative will be kept under review, with the most recent update completed in March of this year. So if we take a look back at the chart we had looked at earlier, you'll see that in 2015, expenditure on blood glucose test strips peaked at about 48 million. And then following the introduction of the automated maximum reimbursement quantities in 2016, expenditure decreased. Expenditure then plateaued at about 40 million, and following the publication of the preferred blood glucose test strips in 2021, expenditure decreased to about 30 million euro. However, at the same time, there was an increase in expenditure on CGM sensors. So we now take a look at some initiatives from the area of CGM sensors. So to give you some background, continuous glucose monitoring, or CGM systems, provide an alternative approach to self-monitoring of blood glucose by measuring glucose levels in the interstitial fluid. These systems comprise of sensors which are self-administered subcutaneously, typically in the upper arm, and are replaced every 7 to 14 days, depending on the system. They comprise of transmitters, or in some cases, combine sensors and transmitters, and also a mechanism to display the results. So that's either a reader or receiver or a smart device application. There are two types of CGM systems. So we have real-time or RT CGM, and we also have intermittently scanned or IS CGM. And this slide here shows you total monthly expenditure on CGM sensors between January 2021 and December 2023. So you'll see in January 2021, expenditure was 1.57 million, and this reflected utilisation by about 6,000 people. However, by December 2023, expenditure had reached 5.35 million, and this reflected utilisation by about 16,900 people. So we'd seen a rapid increase in utilisation and expenditure on CGM sensors. In September 2023, HICWA published a rapid health technology assessment of continuous glucose monitoring in adults with type 1 diabetes mellitus. And this HTA contained a number of recommendations. So it outlined, assuming the HSE continues to reimburse CGM systems, consideration should be given to a single managed access programme for all CGM systems for all individuals with type 1 diabetes mellitus, regardless of age. And such a system would need clearly defined criteria for access. It also outlined that for people with type 1 diabetes mellitus, CGM should be provided in the context of the existing model of care, which includes oversight by specialist diabetes services and empowerment of people with diabetes through access to structured diabetes self-management education. And in addition, the HSE's National Service Plan for 2024 outlined the following for the HSE-MMP. So a requirement was the implementation of a reimbursement application system for continuous glucose monitoring sensors, and also the publication of a preferred product or products evaluation. So following on from this, in December 2023, we had the introduction of an online reimbursement application system for all CGM sensors. So from the 1st of December 2023, all patients newly initiated on CGM sensors must receive prior approval for reimbursement support. And access to the online reimbursement application system is restricted to diabetes hospital clinicians responsible for the initiation of the CGM system, i.e. diabetes medical doctors and nurses. And in the middle of the slide, you'll see a snapshot from the online reimbursement application system that's in place for CGM sensors. Approval is visible at the pharmacy level through the Secure Scheme Checker, and at the bottom of the slide, you'll see a snapshot of the Secure Scheme Checker. So to give you an update on the online reimbursement application system, between December 2023 and November 2024 inclusive, approximately 3,000 patients received approval for CGM sensors under the reimbursement application system. And this is in line with the year one projections in the HICWA HTA report. The additional annual budget impact associated with new patients approved to date is approximately €9 million. And at the same time that the online reimbursement application system was introduced, the PCRS in a circular also published maximum quantities of CGM sensors that are reimbursed on an annual basis. And the latest version of the maximum quantities can be found in the PCRS circular from July 2024. So the final initiative we'll be having a look at tonight is the preferred CGM sensors with associated system or systems initiative. So another recommendation from HICWA's rapid HTA of glucose monitoring in adults with type 1 diabetes mellitus was switching to an economically advantageous system when clinically appropriate to do so may result in cost savings for the HSE. So following on from this, the MMP initiated a preferred CGM process to support access for people while also managing the significant expenditure in this area. And the first step in this process was the publication of a roadmap for the identification of preferred continuous glucose monitoring sensors with associated systems. And this was published in November of 2023. And this followed there was a following 4-week consultation period where it was open to suppliers, healthcare professionals, and also patient organizations to make submissions during the consultation. When a supplier submitted one of their products for evaluation, they had to complete and sign a cover page for submissions, which included confirming compliance of their products with applicable national standards and European Commission standards and all applicable laws. So following the 4-week consultation period, 4 suppliers made a submission. Overall, these suppliers submitted 8 individual CGM sensors, and the CGM sensors submitted varied in reimbursement price and market share. And these CGM sensors had varying features and suitability for different patient requirements. Submissions were also received from healthcare professional and patient organisations. And as part of the evaluation undertaken, the MMP considered 9 different criteria. So we considered the acquisition cost of the CGM sensor. We reviewed the CGM sensor features as well as the associated system features and their costs if applicable. We reviewed the expenditure in the area and potential for cost efficiencies. We also reviewed the provision of patient support services by the supplier and the provision of education resources to healthcare professionals by the supplier. We reviewed the robustness of supply of the CGM sensor with associated system to the Irish market. We also considered patient factors and any other relevant factors, for example, the requirement for calibration with blood glucose test strips. So the outcome of this initiative is the MMP has identified 2 preferred CGM sensors, which we call List A, with associated systems for people with diabetes requiring CGM who are not insulin pump users. And these preferred products are Freestyle Libre 2, and you'll see its reimbursement code and pack size on the slide, and also the Dexcom ONE Plus, again with its reimbursement code and pack size on the slide. So if we take a look at the features of these 2 products in further detail, if we start with Freestyle Libre 2, it has a cost per day of €3.14, and the sensor type is real-time CGM when it's used as with the Freestyle Libre Link app on a smartphone. The age requirement for use is 4 years and older, and the application site is the back of the upper arm. Its lifespan is 14 days, and it has a sensor warm-up time of 60 minutes. Capillary glucose calibration is not required, and neither is a separate transmitter. A separate reader is available at no cost. The name of the smartphone app is Freestyle Libre Link. It has high and low glucose alarms, and it also facilitates data sharing with healthcare professionals through Libre View and data sharing with family and friends through the Libre Link Up app. If we take a look at the features of the Dexcom ONE Plus, on the other hand, it has a cost per day of €3.16. It is also a real-time CGM. The age requirement for use is 2 years and older, and the application site varies depending on the person's age. So if, for example, someone is 2 to 6 years old, the application sites include the abdomen and back of the upper arm. While if someone is 7 years and older, the application sites are the abdomen and back of the upper arm also. The lifespan for use is 10 days, and there's also a 12-hour grace period. Its warm-up time is 30 minutes. And again, no glucose calibration is required, and there's also no requirement for a separate transmitter. A separate reader is available at no cost. The name of the smartphone app is the Dexcom ONE Plus app. It has high and low glucose alarms, and it facilitates data sharing with healthcare professionals through Dexcom Clarity and Gluco, and also data sharing with family and friends through the Dexcom Follow app. So overall, the MMP recommends a preferred CGM sensor with associated system from List A for people with diabetes requiring CGM who are not insulin pump users when first initiating CGM, continuing CGM upon review, and when changing a CGM sensor with associated system. And as part of the publication in July of 2024, we published a preferred CGM sensors with associated systems evaluation report. We've also published a preferred CGM sensors poster, and we also have issued correspondence to stakeholders. So this included PCRS circular, which was issued on behalf of the MMP to pharmacists and GPs. We issued correspondence to stakeholders from the consultation and also to diabetes healthcare professionals. In relation to the non-preferred CGM sensors, CGM sensors with associated systems from List B, so our non-preferred list, are not routinely recommended by the MMP in the absence of clinical justification. So, for example, a patient is an insulin pump user. So this slide here shows you the non-preferred list. You'll see that some of the sensors have insulin pump compatibility, and some of the sensors do not have insulin pump compatibility, so operate standalone. One thing I'd like to draw your attention to is in relation to the Medtronic Guardian sensors. So you'll see the Medtronic Guardian Sensor 4 MMT7040C1. It has insulin pump compatibility, while the Medtronic Guardian Sensor 4 MMT7040QC1 does not have insulin pump compatibility. Both products have separate reimbursement code, so it is important to be mindful of the nuances in the two names. On our website, hse.ie/MMP, you'll find a copy of our two-page preferred CGM sensor poster. So on the first page, for example, you'll find the features of the preferred products listed, while on the second page, you'll find some practice points for preferred CGM sensors. You'll find contact details for replacement sensors, and also some recommendations in relation to concomitant self-monitoring of blood glucose test strips. You'll also find some details in relation to the non-preferred CGM sensors or List B. If we take a look at the potential for efficiencies in this area, so with the two preferred products, Freestyle Libre 2 has an annual cost per patient per year of just under €1,500, while Dexcom ONE Plus has an annual cost per patient per year of €1,502. If we take a look at the annual cost per patient per year of a non-preferred product, so for example the Dexcom G7, it has an annual cost of €3,137. So there is a substantial price difference between the preferred and the non-preferred products for people who are not insulin pump users. So the annual saving, if 1,000 people switched from a non-preferred to preferred product, is approximately $1.63 million. So to summarize the impacts to date from the initiatives in CGM area, the reimbursement application system facilitates reimbursement for eligible patients. The preferred CGM sensors process has led to price reductions for existing CGM sensors, increased use of the preferred products, the introduction of lower cost devices to the Irish market, and also the introduction of more appropriate pack sizes for CGM sensors. As part of that process, we've also received confirmation of company sensor replacement policies. For this initiative, and indeed for all our initiatives, you can visit our website, hse.ie/MMP. So this shows you a snapshot of the preferred CGM sensors website. So you'll see details of the preferred products. You'll also find links to the preferred CGM evaluation report, the preferred CGM sensor poster, and also the correspondence which was issued to healthcare professionals. I'd like to finish up by acknowledging some people. So I'd like to acknowledge all members of the MMP team. I'd also like to acknowledge our colleagues in the Primary Care Reimbursement Service, and thank you to everybody for listening. And again, for all our initiatives, you can visit our website, hse.ie/MMP. Many thanks.
Thank you so much, Stephen and Claire. That was an absolutely wonderful presentation. I'm aware of a lot of the MMP resources, but it was great to have somebody talk us through them and to highlight the features, many of which to be honest, I had not noticed. So that was great. Thank you very much. So if anybody has any questions, please type them into the chat. But I just have a few here to kick off. Can you just remind me about what to do for insulin pump users, please?
Yeah, so in relation to insulin pump users, currently our recommendation is in relation to people who are not using an insulin pump for the preferred CGM sensors. Because our preferred CGM sensors do not have insulin pump compatibility. But I suppose for those people on a non-preferred CGM sensor who are not currently using an insulin pump, a diabetes healthcare professional could give consideration to switching them to one of the preferred products.
Okay, that's great. Thank you. I was really interested in all of the criteria, the evaluation criteria that you use. Like, it's a very rigorous process.
Yeah,
down to
there's a lot of things taken into consideration.
Yeah, and to be fair, like some of those companies do have great resources for pharmacists, for example, around because when people are changing from one Dexcom to another, for example, it can be confusing for the patient as well. Okay, so another question here. So I work in a community pharmacy. So what about patients who are on CGM and they're reporting problems with their sensors? And now that we're limited with what would be reimbursed, what are the recommendations in terms of managing those kinds of queries or problems?
The best thing to do in that situation is for the patient or their healthcare professional. So, for example, their pharmacist or their diabetes nurse will be to contact the company supplying the CGM sensor. And you'll find the contact details for Abbott and for Dexcom on the preferred CGM sensor poster. And for example, if it was a Medtronic product, you'll find their contact details in relation to replacement sensors in the evaluation report. So that'd be the best course of action in that situation.
Okay. Gosh, HSE, is it /MMP?
Yeah,
is a one-stop shop for all of your queries, because we have, in my own personal experience, we have had some, I suppose, queries in that regard because people are concerned about being left without sensors. But I think the information is filtered through really at this stage. Just to reiterate, if anybody has any questions, please type them into the chat. Okay. One has come up here. So if a patient was on CGM prior to December 2023, does the eligibility appear on the scheme checker on the PCRS?
Yeah. So patients who had for patients who were on CGM sensors prior to December 2023, if they're currently eligible, the eligibility will be visible on the secure scheme checker. Absolutely.
Okay, that's great.
It would be best to check the secure scheme checker in that situation.
Okay. And Claire, maybe a question for you about the managed access protocols. Where do we find a list of all of the drugs where there are reimbursement restrictions? Because some things are kind of high-tech drugs are good because you know that there's a high-tech prescription, so that's very straightforward. But with managed access drugs that we're aware of, Entresto and Versatis, I suppose most people would be aware of. But where's the best place to find the rest of that information?
Well, yet again, Fiona, I'm going to direct you back to our website. On our website, hse.ie/MMP, we do have a specific subsection for our managed access protocols. And there we itemize all of the different managed access protocols that we have and all of the medicines that are reimbursed subject to those criteria. So they are very clearly laid out on our website where they fall under the remit of the MMP. So that will be the managed access protocol medicine.
So I think, as you mentioned there, Fiona, you'll find details there in relation to sacubitril, valsartan, and Entresto, lidocaine, plasters. Another one that people might be familiar with will be liraglutide, Saxenda. And then, of course, as Claire had mentioned earlier, another one under community drug schemes with management is bempedoic acid.
And The other one I would think of would be the Xarelto or the
Yeah,
Rivaroxaban 2.5,
exactly.
now,
That
which
would
is
be,
completely off topic. But yeah, I presume that new osteoporosis drug that I'm not even going to attempt to pronounce is high tech, is it?
Romosozumab, yes, it is. It's under the
Very
high
good.
tech arrangement. Yeah.
Okay, so again, that's so much easier from a managed access perspective. Okay, another question. If a patient is currently on a non-preferred CGM, for example, Dexcom 6, will that eventually no longer be reimbursed?
I suppose as things stand, the Dexcom G6 is reimbursed. There's no change to the reimbursement of any of the CGM sensors following the publication of the preferred products. So
Mhm.
as things stand, no, there is no change to
Okay,
reimbursement of non-preferred products.
okay. And I have one other question. You mentioned about preferred drugs, Claire. So say the likes of simvastatin and those kinds of drugs. Are there any plans for extending that list?
Excuse me, yes. So I suppose we have worked to keep the current list of medicines that we have up to date and under review. And we would hope in the future to add some new products to our identified preferred drugs.
Okay,
It
okay,
is an
that's
area of
great.
interest for us.
Yeah, okay, great. And the best value biologics is another emerging area there.
It is,
Uh,
and there are a number of additional BVB processes currently underway. So it is likely we will identify some new classes, I suppose, BVB medicines later on in this year.
okay, and can I ask you a question with regard to best value biologics? On a high-tech prescription, the, the prescriber has got to state the proprietary product. Isn't that the ideal?
So ideally, the medicines will be prescribed via the high-tech hub. And in that
Uh-huh.
situation, the prescriptions will pre-populate with both the
Mhm.
INN and the proprietary name. Exactly, yes. So yes, a paper prescription must contain both.
Okay,
Yeah,
great. All
yeah.
right.
So
Okay.
ideally, if people prescribe to the hub, I suppose it removes that extra step from the prescriber of having to remember to specify
Mhm.
both. And it also, I suppose, removes the need then for pharmacists to have to contact the prescriber to clarify if necessary.
Yeah, yeah. Well, it would be wonderful if more people use the hub, in my
Yes.
view. Yes, but that's outside of your control, I would
It
imagine.
is, but there is a lot of ongoing engagement, I suppose, with
Yeah.
subscribers in that area, and we are undertaking efforts to try and
Mhm.
encourage them to use the hub and various training sessions with them, to bring them into the hub. And I suppose as more and more medicines move into that space, there will be increased use of the hub.
Okay, that's great. Thank you very much. I don't think we have any more questions. I suppose I just urge people again if they have any questions to type them in. I think you gave such a comprehensive and very interesting presentation. So the take-home message really for everybody is to look up give us the website again. It's HSE forward slash.
HSE.ie/MMP.
Very good, thank you. Okay, so just to remind everybody this evening to complete the survey. So Grace has put the link to the post-webinar survey into the chat again, because we really do value your feedback. It helps to inform future in conversation with webinars that the IOP will deliver, because the IOP wants to meet your needs. We can't finish the evening without suggesting that you are urging you to start a CPD cycle around some of what you've learned this evening. I think there were lots of very actionable take-home nuggets that we can embed into a CPD cycle. We're getting some thanks in the chat, which is great. Thank you. Another thing just to mention, two things just to point out before we finish up. Firstly, phase 3 of the LIFT IAOP roundtable sessions is starting shortly. Registration is open. You can book a place by the 6th of May and they're starting on the 12th of May. And I think that most of us will have received emails at this stage from the IOP in that regard, but you can book via the courses and events section of the IAOP website for anybody who's interested. And any feedback I've had on the LIFT sessions has been very, very positive. And the last thing to mention is that our next webinar is going to take place on Wednesday, the 14th of May at 8 p.m. And it's going to be on the use of medicines in CAMHS and Youth Medicines Information Service. So invitations will be emailed to your usual email, and they will also be advertised on the IOP socials. So just to thank Claire and Stephen again this evening for a really, really wonderful presentation. Thank you so much. And thanks Grace very much, who's working very hard in the background and keeping the show on the road. And to wish you all a very good evening and to enjoy the rest of the lovely weather. So hopefully the lovely weather will carry us into the bank holiday weekend, which would be fantastic. So good night. Thank you so much.
Thank you.
Thank you.